In my experience, most physicians do rank patient care and the relationship is top. Top. That's the reason they did what they did. And financial is lower somewhere on the priority list. But I think what I've seen sometimes happen is when you kind of clarify that or put that out there, and then maybe you realize that the hospital system that you're working in is in direct conflict with that and causing a lot of the problems. And autonomy would be the ability to change it so that you can get back in line, is not there. So you're kind of in a like no way to change. You're in a straitjacket. So then the next thing I would naturally raise is like a third party observer is like, okay, well, what if we could leave and switch it around where you're like, patients are number one, and then we shape everything around that, AKA private practice.
Exactly.
And
No,
then
that's exactly right.
usually when I bring that up, it's like immediately the stuff that starts coming up is financial, which is so interesting because it's the low thing.
But that's, well, right. So it's not the reason you went into medicine, but then when you're in charge of your own business, like in any other business, that's one of the scare points of going into practice, right? So how do I do it? How do I get the money to do this? How do I manage payroll? How do I know how to sign up with insurance companies? All that kind of stuff is the reality, which scares a lot of people because they haven't been exposed to how to do it. So again, it goes back to the training type of things where if you realize that your business is taking care of patients and there are lots of resources that you can outsource to take care of the things that you don't know how to care. And of course, it's a process. You make bad decisions, you make good decisions. And at the end of the day, you have control, and that is a great source of satisfaction.